That's a powerful and evocative introduction. It paints a stark contrast between the glitzy image of Las Vegas and the harsh reality of homelessness. The language does a great job of drawing readers into a deeper reflection on society's blind spots. Would you like to build on this intro or refine it further for a specific purpose, such as a script or article?
I remember being normal, and there's nothing to do. And I can't wait, but I'm still leery about it. I gotta leave all this behind, I know that. But getting back with my family, that's what's really my drive.
In 2024, Clark County, home to Las Vegas, recorded 7,906 individuals experiencing homelessness in just one night, with more than half of them living unsheltered. These people are exposed to the brutal desert heat during the day and freezing Nevada nights. This statistic is part of the larger trend across the U.S., where more than 770,000 Americans are without a home, a 20% increase since the previous year.
I'm not a bad person. I've never been a bad person. I'm just stuck. I'm just stuck.
In Las Vegas, the crisis feels especially stark. It unfolds in a city built on wealth, luxury, and excess, contrasting sharply with the growing number of people without basic shelter. The causes of homelessness here are varied. Some individuals lost their jobs as rent prices soared, while others, families with children, were displaced by medical debt or a single paycheck lost. Among the most heartbreaking are the young people, teenagers who, instead of braving the dangers of the streets, find refuge in the underground flood tunnels, away from the world above. At the 2024 Nevada Youth Homelessness Summit, advocates shared a disturbing statistic. Nearly 150,000 homeless youth nationwide, with Las Vegas being one of the hardest hit areas. This is not just a statistic, it's a call for urgent action. The human cost of this crisis is immeasurable. Those living in makeshift tents along the sidewalks face constant dangers, disease, violence, and a sense of hopelessness. Picture a family cramped under a tarp, just a few blocks away from tourists, spending thousands on a single night's entertainment. This is the paradox of Las Vegas, a city built as a playground for the world, yet a stark reminder of America's deepest inequality. Homelessness in Las Vegas is more than a local tragedy. It's a reflection of a national failure to provide stability, dignity, and hope for all. Until we confront this uncomfortable reality head-on, the shadows beneath the neon lights will only grow darker. So, I ask you, how should a city built on dreams respond to the nightmare unfolding in its own backyard? Substance abuse is one of the most destructive forces driving homelessness in Las Vegas, creating an unyielding cycle of despair. Addiction to methamphetamine, opioids, alcohol, and increasingly fentanyl strips individuals of their stability, draining their bank accounts, severing family bonds, and destroying their ability to maintain employment or pay rent in a city where housing costs have soared. For many, addiction is not just a personal battle. It's the tipping point that pushes them onto the streets. Once homeless, the struggle only intensifies as the lack of treatment and support perpetuates the cycle of dependency.
That's something that happened with me due to my addiction. I lost my house, had my own first house, so I lost that because I wasn't making payments because my money was going to drugs. So, you know, it's a constant chase. It's a 24/7 job. You miss out with your family, and like you miss out on all the good shit. And that's why I mentioned like how just looking at a field to me is like beautiful, or just watching beach waves, like listening to them crash, like things like that, enjoying the little things. I've been robbed 3 times out here, and you know, it really like beat me down to the point where it's like that's all materialistic shit. Like you can get a new phone, you can get a new book bag. Like what's really important is your time and how you spend it, I think.
The crisis has worsened with the rise of fentanyl, a synthetic opioid up to 50 times stronger than heroin. Cheap, potent, and easily accessible, fentanyl has become the drug of choice in Las Vegas's underground economy, particularly in encampments and the city's flood tunnels. Its grip is merciless. Just one pill can ensnare someone, and an overdose can be fatal within minutes. In 2023 alone, Nevada saw record numbers of fentanyl-related deaths, many of them tied to those already living without shelter. For the unhoused, whose bodies are already weakened by malnutrition and stress, fentanyl's lethality is only magnified. This cycle of addiction does more than take individual lives. It undermines recovery efforts across the entire community. Those trapped in addiction often lack the clarity or energy to seek rehabilitation or job training. While Las Vegas does have treatment facilities, they remain underfunded and overwhelmed, unable to meet the growing demand. The result is predictable. Individuals remain stuck on the streets, with their chances of reintegration diminishing as their addiction deepens. The consequences stretch far beyond those directly affected. Encampments, often marked by heavy drug use, become hotspots of violence and petty crime, putting immense pressure on law enforcement and emergency services. Hospitals are overwhelmed with overdose cases, diverting critical resources from other patients. Meanwhile, the image of Las Vegas as the entertainment capital of the world is challenged by the sight of people openly battling addiction just blocks from the Strip. What does it say about our priorities when a city built on excess and indulgence struggles to provide even the most basic care for its most vulnerable? Substance abuse, especially fentanyl, doesn't just fuel homelessness in Las Vegas. It magnifies America's broader failure to address a crisis hiding in plain sight. To understand why homelessness has entrenched itself so deeply in Las Vegas, we must look beyond the city's glittering surface and examine the deeper forces reshaping its landscape. At the heart of the crisis is an unforgiving housing market. Over the past decade, rents have skyrocketed far faster than wages, pushing working families to the edge. Even those with full-time jobs in Las Vegas's core industries, hospitality and service, are struggling to cover basic expenses like rent, utilities, and food. When the last remnants of pandemic-era relief expired, many who had relied on rental assistance or eviction protections found themselves exposed, leading to a sharp rise in homelessness. However, economics alone cannot fully explain the depth of this crisis. Mental health is another critical factor. For those living with untreated depression, PTSD, or anxiety disorders, the lack of accessible care leads to a slow, painful collapse. Without proper support systems, individuals fall through the cracks, moving from unstable housing situations to life on the streets. Las Vegas's limited mental health infrastructure simply cannot meet the demand, leaving thousands without the help they desperately need. On top of these challenges are stark social inequities. Black Americans and Native communities are disproportionately represented among the homeless population in Clark County, a reflection of generations of systemic exclusion from stable housing and economic opportunities. Domestic violence adds another painful layer. Survivors, often women with children, may escape abusive households with nowhere safe to turn, finding only temporary refuge in overcrowded shelters before falling into chronic homelessness. Environmental pressures further compound these vulnerabilities. Wildfires, flooding, and extreme heat in neighboring regions displace families who migrate to Las Vegas in search of safety or employment, only to find a city already stretched to its limits. Migration from other states also contributes to the influx of people chasing the dream of opportunity in a city known for reinvention. But without affordable housing or a robust safety net, many instead encounter disappointment and despair. Homelessness in Las Vegas is thus not the result of a single failure, but a tangled web of economic, social, and environmental forces that together make survival increasingly precarious. To address this crisis, the city must look beyond temporary solutions and recognize that homelessness is not an individual failure, but a collective responsibility that demands urgent, systemic change. The homelessness crisis in Las Vegas extends far beyond those sleeping in tents or flood tunnels. It ripples outward, affecting the very fabric of the city and testing its resilience. For those without shelter, every day is a fight against exposure and vulnerability. Lacking basic sanitation, clean water, and reliable food sources, they face preventable illnesses and malnutrition. The constant threat of theft or assault turns survival into an exhausting battle. For children, the toll is even more severe. Interrupted schooling and the trauma of instability create lasting scars, perpetuating cycles of disadvantage long after the immediate crisis is over. The wider community also bears a heavy burden. Hospitals in Las Vegas regularly see a surge in patients whose untreated conditions worsen on the streets, ranging from respiratory infections to injuries sustained in unsafe encampments. Emergency rooms are overwhelmed, diverting vital resources and staff from other pressing medical needs. Police, outreach teams, and sanitation workers are similarly stretched thin, trying to manage sprawling encampments while balancing safety with compassion. Yet, these efforts often feel more like triage than long-term solutions, leaving frontline workers overburdened and under-resourced. Tourism, the lifeblood of Las Vegas, is also feeling the strain. Visitors come seeking glamour and escape, only to encounter visible poverty just blocks from the luxury resorts. This stark contrast undermines the carefully cultivated image of the Strip, threatening not only the city's reputation, but also its economic stability. Hoteliers and business owners are increasingly concerned that unchecked homelessness could erode the very appeal that sustains their industry. The financial toll is staggering. Millions of dollars are spent each year on temporary shelters, emergency health care, and cleanup operations. Yet these efforts largely treat the symptoms, not the root causes. The relentless drain on public resources leaves little room for long-term investments in housing or preventive measures. Meanwhile, community divisions deepen, with some residents advocating for compassionate solutions and others calling for stricter enforcement to remove encampments. This tension underscores a deeper dilemma. Will Las Vegas address homelessness with empathy and foresight, or with short-term fixes that only perpetuate the cycle? Ultimately, the struggle playing out on its streets forces the city to confront a question that echoes far beyond Nevada. How can a nation so adept at creating illusions of wealth and entertainment reconcile with the poverty that exists in its midst? Las Vegas has not turned a blind eye to its homelessness crisis. In recent years, city leaders, county agencies, and nonprofits have rolled out various programs aimed at providing relief and pathways towards stability. The Courtyard Homeless Resource Center, located near downtown, stands as one of the most visible efforts, a 24-hour facility where hundreds can find a bed, a meal, and a brief respite from the streets. For many, it is the first step toward reconnecting with essential services, from healthcare to employment programs. Other initiatives focus on reducing barriers to housing, such as streamlining paperwork, expanding rapid rehousing vouchers, and offering job training. These efforts demonstrate a willingness to confront the crisis, but they remain modest in scale compared to the magnitude of the problem. Nonprofits continue to shoulder a significant portion of the burden. The Nevada Partnership for Homeless Youth, NPHY, advocates for young people and provides outreach and emergency housing focusing on one of the most vulnerable groups. Catholic charities, faith-based shelters, and grassroots organizations also offer food, clothing, and transitional housing to those in need. Their dedication is undeniable, but the demand far outpaces supply. Many of these organizations face chronic funding shortages, staff burnout, and limited coordination, resulting in fragmented services that sometimes overlap while leaving other needs unmet. The limitations of current efforts are clear. Most programs remain focused on immediate relief, temporary shelter, food distribution, and emergency medical care. While these services are critical, they rarely address the structural forces driving homelessness, the severe shortage of affordable housing, the lack of comprehensive mental health support, and the overwhelming presence of addiction. Treatment facilities are stretched thin, leaving countless individuals without access to recovery programs. Equally troubling is the absence of a unified long-term strategy. Government agencies, nonprofits, and the private sector often work in parallel rather than in true partnership, resulting in a patchwork system that struggles to keep pace with the growing crisis. Until Las Vegas moves from short-term fixes to coordinated, sustained action, its efforts will remain well-intentioned but insufficient against a challenge of this scale. If Las Vegas is to confront its homelessness crisis meaningfully, it must move beyond emergency responses and towards structural solutions that address the root causes of the problem. At the center of this transformation is housing. Expanding affordable housing stock through tax incentives for developers, public-private partnerships, and the conversion of vacant properties into livable units remains the most urgent priority. Without stable housing, other interventions lose their effectiveness. A housing-first approach, proven successful in cities like Houston and Salt Lake City, offers a model that Las Vegas could adapt, ensuring that shelter is not conditional, but foundational. Alongside housing, comprehensive healthcare must be integrated into the strategy. Expanding access to mental health treatment and addiction recovery programs is critical, especially as fentanyl and methamphetamine devastate lives across Clark County. Mobile clinics, crisis stabilization units, and sustained funding for long-term treatment facilities would allow individuals not just to survive, but to rebuild. For young people, prevention is equally vital. Schools, youth centers, and mentorship programs can serve as protective nets, catching vulnerable teens before they slip into chronic homelessness. Collaboration will be key to the success of these efforts. A unified strategy linking government agencies, nonprofit organizations, healthcare providers, and the private sector can reduce duplication and maximize impact. Instead of fragmented services, Las Vegas needs coordinated case management, where individuals are guided seamlessly from street outreach to housing, healthcare, and employment. Data-driven approaches, tracking outcomes, measuring success, and holding agencies accountable can ensure resources are used effectively. Equally important is shifting public perception. Homelessness is not a blemish to be swept away from tourist corridors. It is a human crisis that demands empathy and systemic change. Public awareness campaigns, coupled with civic engagement, can build the political will necessary for bold reforms. Las Vegas has mastered the art of reinvention, transforming desert sands into a global destination. The same creativity and determination can be harnessed to tackle homelessness. The question now is whether the city will extend that spirit of innovation to its most vulnerable residents, proving that even in America's playground, compassion can shine as brightly as neon. As I walk through Las Vegas, I am struck by the glaring contradictions. On one side, shimmering towers promise endless indulgence. On the other, a man sleeps on the pavement with nothing but a worn blanket. For me, this is more than a statistic or a headline. It's a moral reckoning. I have spent years studying homelessness across America, and nowhere does the contrast feel sharper than here in the desert, where abundance and desperation exist side by side. What I see in Las Vegas is a reminder that homelessness is not simply the result of poor choices or bad luck. It is the outcome of systems that fail to protect people when they stumble. A sudden medical bill, the loss of a job, or the end of a relationship can be enough to push someone onto the streets. Once there, the climb back is steep, especially when affordable housing is scarce and treatment options for mental health or addiction are overwhelmed. But beyond the data and policies, there lies something more profound. Our responsibility as a society. Do we measure success only by the wealth on display, or also by how we treat those with nothing? Las Vegas, in its brilliance, has the power to inspire. If this city can engineer fountains that dance and replicas of global wonders, surely it can imagine solutions for those who sleep in its shadows. For me, the crisis is personal, not because I have lived it, but because I believe indifference is not an option. To walk past suffering without acknowledgement is to accept it, and that I cannot do. Conclusion. The homelessness crisis in Las Vegas is not just a local challenge. It is a reflection of our nation's deepest divides. In a city renowned for its brilliance and excess, thousands remain in the shadows, struggling against addiction, poverty, and systemic barriers. Yet, within this stark reality lies an opportunity for change. Las Vegas can prove that compassion and innovation are not opposites, but partners in creating a stronger, more just future. Whether through supporting shelters, advocating for affordable housing, or demanding lasting policy reform, each of us has a role to play. If we choose action over apathy, Las Vegas can become not only a city of dreams, but a city of dignity, one where no life is forgotten and no one is left behind.